In today's segment of Health Boost, I want to focus on dementia. How does it get noticed? What are the symptoms? How can it impair one's ability to remember, make decisions? And importantly, can we possibly avoid Alzheimer and dementia? I want to bring in Sneha Mordani, who ensured that we get all the latest details from our experts on this as well. So Sneha, first to you, because many would say that this could be becoming increasingly more common than it earlier was. Celebrities have confirmed they have been suffering from dementia. How does one notice it? What are the symptoms? And can one really avoid with regard to this disease?
Ujjay, today our focus really is on frontotemporal dementia. There are different kinds of dementia.
Okay.
But my specific focus is going to be on frontotemporal dementia because of a unique case of a patient who was in fact seen to be indulging in behavior which is considered antisocial, from stealing things in a shop. And I'm talking about a respected professor. From stealing things in a shop, and we're not revealing his identity, to lewd behavior. Not wearing the right kind of clothes, inappropriate behavior with female members of his family, like his daughter-in-law, for example, and inappropriate dressing in the house when younger people are around, misbehaving with people, lifting things from a shop, including lingerie from a shop, is what made this one person come into the radar of the hospital in question here. The patient's son essentially went to a doctor saying that this is the father's behavior of late and that there is something wrong with him, or else why would a respected professor indulge in antisocial behavior of this nature? And guess what? This kind of behavior has now been associated with frontotemporal dementia, and that's the reason why we are putting the focus on frontotemporal dementia and why the symptoms are fairly unique and very disturbing also for the family members as well. First of all, it is vague, so one really can't get their heads wrapped around what's really going on as far as the patient is concerned. But because the symptoms are so unique, the patient's son found it imperative to approach a doctor. His father's behavior is weird. What's really going on? And the doctors diagnosed him with FTD. Take a look at this report. A disease that decays your ability to think, remember or take decisions. A person suffering from dementia loses their ability to think rationally at times as well. To understand this better, let's take the example of what Mr. Venkatswamy, we've changed his name, went through. Venkatswamy is a well-respected individual in his social circle as well as his family. Until one day when his son, Ramu, receives a call from a local shopkeeper. According to him, Venkatswamy attempted to steal several women's underwear, lingerie from his shop. The shopkeeper even threatened to report this incident. Ramu recalled another incident from a while ago when his father stole a bottle of perfume from a nearby shop. The owner this time was known to the family, so the incident was resolved amicably. One day something happened which shook the entire family. He walked into his daughter-in-law's room and said to her, "You look so pretty and your figure is perfect." His son Ramu didn't take any chances this time and took his father to the doctors for a consultation. Dr. Sudhir Kumar, a neurologist from Apollo Hospital in Hyderabad, whose tweet led to the propagation of this story, shed light on this. Venkatswamy was diagnosed with a behavioral variant of frontotemporal dementia.
So if you look at our frontal lobes, which are mainly in the front, if those lobes are damaged, then a person can have disinhibition. So basically the person doesn't know what to do and what not to do in front of others.
Symptom of this disease usually includes social withdrawal, apathy, limited interest in family, among others.
For example, he may dress inappropriately in front of others, or he may start changing his dress in front of others. Sometimes they urinate in public.
There is no cure for frontotemporal dementia. All hope, however, is still not lost.
If a disease is found, identified, then proper treatment may help in many cases.
While there is no cure for this disease, other treatments such as speech therapy may help with the symptoms.